Hi everyone, I'm John Jay. If this is your first time seeing me or watching one of my videos, welcome. For those of you who have been following me for quite some time now, or even my new followers, I want to say thank you so much. I do appreciate your support. So today I want to be talking about on a topic. This is something that is fairly common. It's a fairly common practice among a lot of us, and we are all guilty of it. If not everybody, a vast majority of us are guilty of this. And especially those of us that are living in developed countries where this is fairly available for us. And this is self-medicating, taking medication that are self-prescribed, meaning no doctor or healthcare provider advise you to do it, and we just do it. So because it's readily available, like I said, for people that are living in developed countries, you can stop at any of your local drugstore or pharmacy like CVS, Walgreens, and you can pick it up fairly easily. And then a lot of us do this because either we don't have time to go to the doctor, or we don't have time to go to the doctor, or it's just convenient for us. But self-medicating can be very dangerous if care is not taken. There are some drugs or some medication that can be harmful if it's used more than prescribed or more than recommended based on the bottle of the medication. So in one of these medications that the one in specific that I'm going to be talking about is called NSAIDS. It's called NSAIDS. So if you can see my little notepad here, I'm going to be discussing today dangers of heavy usage of NSAIDs and kidney disease. Some of these over-the-counter medication can be dangerous to your kidney. So NSAIDs is an acronym that is used to describe a group of drugs, a specific kind of medication fall within that group of NSAIDs. And what NSAIDs means is non-steroidal anti-inflammatory drugs. These are called NSAIDs. And the most common ones that we are all guilty of having, if you check in your house right now, in your medication cabinet, in your bathroom, your kitchen cabinet, wherever you keep your quick to reach medicine, I'm sure you'll find a bottle or two in there. So the most common non-steroidal anti-inflammatory drugs that we all are guilty of using is Motrin, or the other name is called ibuprofen. All right, so ibuprofen there's ibuprofen, which is also called Motrin or Advil, and then there's Aleve, which is also known as naproxen. So those ones are fairly accessible because you can get any bottle of Aleve from your local pharmacy without any doctor prescription. You can get a bottle of Motrin. You can get a bottle of Advil from any of your local pharmacy, and you don't need a prescription for it. So a lot of us tend to get it, and we take it because maybe you're having headache or you work so hard. Some of our older folks work physical jobs, like either in warehouses or in a nursing home or group home. And some people even not because of job-related pain, but elderly pain like arthritis. So we get these drugs and we take it, but there are dangers to overusing them, right? So NSAIDs, one of the things that NSAIDs, this group of drugs, does is it reduces the bodies, because normally our body produce different types of hormone. So one of the hormones or the chemicals that our body produces is called prostaglandins. All right? But NSAIDs reduce the production of that chemical. And this prostaglandins is good for the body too, because it helps maintain the lining in your stomach, which is called mucosa lining. So these prostaglandins that our body naturally produces is good for maintaining inside our stomach and our intestine. It also promotes blood clotting, and it also helps our kidneys to function or to work the way it's supposed to work. But NSAIDs, one of the action on the body is it reduces the production or the amount of this chemical that our body produce for us. So that's why can make it dangerous if care is not taken and we are overusing this drug. All right. And the reaction, the negative effect of overusing these over-the-counter medication, like the ones that I listed earlier, is that it can raise your blood pressure and it can be harmful to your kidneys. Most people that have kidney disease or kidney failure, some of them is related to these drugs that are toxic to the kidneys. So that's why we want to be careful. So if you are out there and you are already prone or you already are high risk of getting kidney disease, like if you have diabetes, if you have high blood pressure, you already are high risk for developing kidney disease at some point in your life. So you want to be careful and very cautious with taking most of these over-the-counter medications, specifically Motrin, ibuprofen, Aleve, Advil, the ones that I listed earlier. If you have to take it, there are some steps you can take to protect yourself. All right? If you have to take it, don't take it regularly. Okay? Don't take it more than a few days in a row. Like I said, especially if you're already prone to kidney disease, like you're living with high blood pressure, you have diabetes, those two diseases are the two main reasons for kidney failure. So you already at risk for getting kidney disease. So you want to be very careful. So even if you don't have any of these diseases, you also want to protect your kidneys function. So if you have to take Motrin or any of those drugs that I listed, do not take it more than few days in a row. Occasional here and there, maybe you can get away with it. But if you find yourself needing to take it every single night or multiple times during the day, then you want to be cautious with that. All right. Next, you want to check with your doctor or your healthcare provider before taking any medication, even if it's over-the-counter medication, whether it be vitamin, supplement, whether it be any of these local pain medication, whether it be any herbal medication. Always check with your healthcare provider or your doctor before taking any of these medications, because some of them can counteract the effect of the other by either increasing the effect of some medication that you take or lowering the effect of the medication that you take. And if you're taking blood pressure medication, you want it to work for the reason why it was given to you. So you got to be careful. Check with your doctor or your healthcare provider before taking any over-the-counter medication. Next, you want to make sure you read the direction on the bottle, on the medication bottle. And don't take more than the bottle recommend you to take. If on the bottle it said do not take more than 4 tablets within 24 hours, you want to stick. I'm just using that as an example. That's not what is on the bottle. I'm just using that as a reference. Always stick. Make sure you read the direction on your medication bottle that you get from over the counter and understand it clearly, and do not take more than is recommended on the bottle. All right. Try to use as little as possible. And if you have to take it and you're having all this pain, another way that you can help protect yourself is by alternating it with acetaminophen. And the other name for acetaminophen is Tylenol. So let's say you take Motrin today, maybe, and you took it in the morning. Maybe in the evening you need another dose of Motrin. Instead of taking Motrin, take the Tylenol in the evening. So you want to alternate which one you take, and don't just take Motrin across the way. Because Motrin, again, can be very harmful to the body if it is overused. So be careful what you put in your body. Never take any medication without discussing it with your healthcare provider or your doctor. Always go back to your doctor, discuss your issues or your concerns that you are having, and let the doctor give you the best recommendation Again, the goal is for us to all be proactive for our health, take charge of our health. Make sure we're not putting chemicals in our bodies or medication in our body that will be harmful to us or cause more problems down the line. All right, so I hope this video was helpful. Just some quick tips. And another thing with Motrin is too, if you're taking it, you cannot try not to take it on an empty stomach. Like I said, that hormone, that Motrin reduces, that chemical that Motrin reduces in our body, it helps protect the lining of our stomach and our intestine. So if you take the Motrin and that chemical is reduced, if you take Motrin on an empty stomach, it can cause stomach upset. So if you have to take Motrin or ibuprofen or any of these NSAIDs that are listed, do not take it on an empty stomach. Take it with some food or milk or something to that effect. But never take any medication without consulting your doctor or your healthcare provider. Always finalize and discuss your issues and your concerns with your healthcare provider. My videos are for information purposes only. They are not any doctor's recommendation. It's just to provide you with helpful tips that you can help protect your health. If you have an issue or a medical concern, please consult your healthcare provider. I hope my video was helpful, and I look forward to coming back with more. If you have any suggestions for topics, please leave it in the comment. And if not, everybody take care. Have a blessed day. Have a blessed evening. Have a blessed morning. Have a blessed night. And I look forward to coming back. Bye.